Dutch Stiftung Weltbevölkerung, meaning German Foundation for World Population, is an international development organization which focuses on the needs and potential of the largest youth generation in history. Its objective is to empower young people, especially young women and girls, by creating demand for and access to youth-friendly health information and services, including modern contraceptives, and by securing their right to bodily autonomy. With offices in Europe and East Africa, DSW achieves this through a combination of youth-oriented programs and gender transformative advocacy that also champions for investments in research and innovation to fight poverty-related diseases.
DSW, it means Dutch Stiftung Weltbevölkerung, which means German Foundation for World Population. It is established in 1991 in German by German entrepreneurs. I would say that there are three, and some of them are still in the management of the foundation in Germany. And so it has a liaison office in Berlin. The head office is based in Hanover. And we have also a liaison office in Brussels, and the DSW is currently very active implementing different projects in East Africa, mainly in Ethiopia, Uganda, Kenya, and Tanzania. And we work also through partnership in other countries like Nepal.
DSW is a non-governmental organization. In our town, it works on workplace intervention or youth health on factories and farms. It has been 6 years since DSW came to our town. It has done a lot of works in these 6 years. It works on two things, a factory and a health center.
DSW initially identified about 7 rural districts in East Wallagga zone, where it surveyed one of the highest rates of prevalence in early marriage. Many suffered from childbearing-related health conditions, including mortality. DSW mainly works on sexual and reproductive health of youth, working closely with Ministry of Health and regional health bureaus, focusing on young people working in flower farms and industries, and it created referral linkage by which these users get health information and services.
We are primarily working on sexual reproductive health of youth. We closely work with the Ministry of Health and its organs, including regional health bureaus of Amara, Oromia, Southern Nation, Nationality, and other regions where we are implementing.
ከነሱ ጋር ከዛሬ 6 ዓመት አካባቢ ስንገናኝ በስራ ቦታ የሚገኙ ወጣቶች ላይ
When we met with DSW 6 years ago, they came up with ideas on how to protect the sexual and reproductive health of young people in the workplace. We had their ideas before, but we could not implement it because of budget and various problems. So we welcomed their ideas.
አበተ DSW ወጅን ወርሻሌ ወጅን referral linkage in FIDA, Warshali Ratino Jata.
DSW works by establishing referral linkage with factories. It created referral linkage of health centers with the 7 different factories found in this area to create health awareness for youth working in those factories and people with health problems to come to our health center through that referral linkage. Then counseling services, family planning, HIV testing, pregnancy and many services, including pregnancy monitoring, will be provided in this unit through the referral linkage.
DSW ni akka magala Kenyatti warshaalee garmentii fi warshaaleen abaaboo akkuma beekamu baay'inaan dubartoota kan itti baay'atanii.
As it is known in our city, garment factories and flower factories are dominated by female workers. Women are vulnerable to many things, especially unwanted pregnancies. Young people do not have access to contraceptives because they have difficulty getting them out of work. Therefore, they are exposed to unwanted pregnancies.
DSW first organized Project Advisory Committee to implement this plan to work collaboratively with different sectors at Warada level.
Project Advisory Committee ta'ee hojjedha.
I'm serving as a project advisory committee. After coming up with what the project would do and what it would focus on, a committee was established in different sectors, and I work as one of those committees. When it comes into areas, the first is how young people stay healthy in the workplace, and the second is how they get services on reproductive health, because often young people spend much of their time at work so that they have difficulty going to the health clinic. So if they come here, they are given various trainings on how to work, and then they have a youth dialogue. It means that they come with a strong understanding in that dialogue. So firstly, they have a referral linkage for how they come to the station if they are sick. They apply what they learn there. They get family planning services, various counseling services. There is also health education, and if they want to get health services, they come to the health center.
ወደ ተግባራ ስንገባ እንግዲህ ወጣቶች ላይ የሚሰሩ ጤና ባለሙያዎችን በማሰልጠን ክላሶችን ሪኖቬት በማድረግ
Initially, I was trained through DSW. After we trained, we gave the courses we took there to the women working here. Since most of the employees here are women, there are courses that they have to take. There are 8 courses that we have trained in there, so the women will take these courses.
DSW Development Organization also provides trainings on family planning for both service providers, users, and gender-based violence committee organized.
In terms of family planning and related services, they need to educate their peers, be it married or unmarried. They need to get full information. So this information helps them to make an informed decision about their own life, instead of relying on somebody to make a decision and maybe exposed to different sexual reproductive health related problems. In terms of capacity building for service providers, as I mentioned earlier, we use referral linkage to public health facilities, so capacitating health professionals in public health sector is very important. So we provide training on comprehensive family planning, sexual reproductive health related GVV case management, youth-friendly service provision, GVV related awareness creation, and also counseling, mainly HIV testing and counseling. These are really the major capacity building that we provide to providers. But not only to those individuals, we also capacitate the facility itself. We equip with medical equipment, we renovate, we provide supplies because there are shortage of supplies in the country. So in order not to end up in stock out and limit the service that they are providing, we also provide supply to our partners, mainly service delivery outlet in the public health sector. We also provide services through our own youth-friendly clinics.
There are many trainings from DSWs like family planning, counseling, STIs, OPD services, GBV services, for GBV services. GBV means gender-based violence services. We have get from DSW more than 3-4 trainings.
Leenjiiwwan garaagaraa nu kenneera. Fakkeenyaaf leenjii karoora maatii akkaataa kennamu.
It gave us various trainings. For example, it has provided us with training on how to provide family planning, gender-based violence, and gender-related issues in collaboration with health sector, women's affairs, police, and prosecutor's office. After we are trained, we are going to factories and schools to teach and train these young people.
They gave training for our health facility workers. They gave for HOs on who works at youth clinics. For nurses, they give training so that even they give training for different sectors in our town, so that there is a collaboration between different sectors. For example, judges, they know if something has happened, they will come and talk to us about, for example, if there is a rape case, they will contact us because there is a collaboration. And Child and Women Affairs Bureau has a collaboration with us so that they give training.
በዲኤስደብሊው በኩል ስልጠናዎችን ወስጃለሁ።
The training we received was on infectious diseases like sexually transmitted diseases such as syphilis, HIV/AIDS, and gonorrhea. Receiving the lesson is very good for us.
DSW Ethiopia has come a long way in learning and mastering project management, focusing on various youth empowerment interventions piloted and scaled up in partnership with the Packard Foundation. DSW has been providing various trainings for youth, girls, and young women, including gender equality, sexually transmitted diseases, youth-friendly health information, and services including modern contraceptives and how they secure their right.
In terms of empowering young people, we provide different trainings, different courses, mainly leadership and management, because we believe young people are a leader. In our motto, it says "Youth can." We believe in the potential of young people. Once they are capacitated, they really do. In order to improve their sexual reproductive health, so many activities. So leadership and the management is one of the courses that we provide, and many club leaders who used to be club leaders currently are a leader of a different organization in the country. The other one is facilitation skill and advocacy and communication. You know, we are encouraging young people to advocate for their rights, lobby to government officials in their context, in their locality, at the regional level and at the national level, so that they bring their issues on table with leaders, so that they also influence decisions which influence their life.
Waa'ee dhukkuboota daddarboo keenya fana kafantoo dhukkuboota wal qunnamtii saalatiin daddarban akka fantoo HIV
The training we received was on infectious diseases like sexually transmitted diseases such as syphilis, HIV/AIDS, and gonorrhea. Receiving the lesson is very good for us.
Dhaabbata DSW kan akka itti beeku jechuudha. Dargaggoota leenjii adda addaa kenneefi jechuudha.
As far as I'm concerned, DSWs and organizations that provide various trainings to youth to bring them out of darkness or ignorance into the light. I received training from DSW and could quit the various addictions I had before the training, even from drinking to chewing cat and smoking. But after I took that training, I wonder if I was able to withstand peer pressure.
I've gained so much from the DSW training. Before, I was afraid of buying pads or sanitary napkins if there was a guy around the shop. I will find a woman's shop and go buy it and come back. But after this training, I have gained confidence and I'm able to talk accurately about my health. Previously, I would run away if they called condom, let alone touching it. Now I have come to understand the benefits of condoms in preventing various diseases and pregnancy. I also teach my friends in rural areas the health lessons I learned. It has made us bright young people. We can talk to each other freely. We used to be afraid of each other, but now we talk freely. The DSW has made clear that even if a woman is sexually active, she should be concerned about her health and confidently carry a condom.
Karoora maatiitirraa kan argatan ulfaantaniif saaxilamuu dhiisu.
The lessons we learned also include family planning, avoiding unwanted pregnancy, avoiding unsafe sex, and preventing sexually transmitted diseases.
DSW ከ3 ዓመት በፊት አሁን 4ኛ ዓመት ውስጥ ነው ያለነው የጋራ ስምምነት አድርገን ነበር። እነሱ እርዳታ ነው የሚያደርጉት፣ ትምህርት ስልጠና ይሰጣሉ ለእያንዳንዱ ሰራተኛ።
DSW signed a memorandum of understanding 4 years ago. DSW provides trainings for each worker here and donates to the workers different things. Provides educational training. They have a training center at Bishoftu town. They take young people to the training center and teach them lifestyle training. Thereafter, each of them gains knowledge of life. They change their life and pave right track for themselves and then come here and give training, which means they will move on to change their partner's life and adjust their lifestyle. Moreover, there are workers who are late or absent from work. They are trained to reduce turnover. each DSW trained here has changed themselves, their families, and the factory. Changing the factory means changing the country.
DSW undertook piloting workplace intervention with the focus on addressing the sexual and reproductive health needs of the young employees of the flower farms and industries who would have long been considered safe and were not targeted by any interventions prior to DSW. DSW has launched intervention to delay first births and space childbearing among unmarried adolescent girls and has been providing contraceptives to those girls and women on work.
I have taken family planning from DSW and have used 3 months contraceptive injection. Contraceptive injection is given for 3 months, 3 years, 5 years, and 12 years.
Karoora maatii fayyadamaa jira akka dhuunfaa kootiitti jechuudha akka dhaabbata Huccuu Arbaa Mincittis.
Personally, I'm using family planning from DSW. As the Arbaa Minch garment factory, many of us come from rural areas. There were many young people who were exposed to unwanted pregnancies due to lack of awareness about family planning. Since we have taken this lesson from DSW, we have acknowledged ourselves and as a young people here. Personally, I'm taking and using the implant birth control method because I have been married for about 2 years. I have a child. I have taken a 3-year implant after my husband and I discussed and decided to have children by delaying.
Another worth mentioning of DSW work is the organization of Gender-Based Violence Committee, which includes heads of women and children affairs, attorney generals, police, and health professionals to protect and take the necessary actions if it happened. This committee took training and started working to address gender-based violence and related issues by teaching to protect and by giving immediate solution when it happened.
When it comes to GBV, it is a hidden issue which has never come to the front because people exercise it in a very secret way. So in the workplace, my observation is it is happening at 3 places. The first one is as a workplace. Supervisors, they do harassment and then they arrange, and the employees, they are not reporting and they don't know even where to report. The second is on the way going home and back to the workplace, on the road. They are facing so many challenges. Even in the transport, you can consider the different transportation mechanisms that we are using, and those who do not afford, they are largely using the public ones. So they are also very much vulnerable on the road. Third is the residential area, in the community where they are living. As their salary is very low, they rented rooms in a very remote or on the peripheral part of towns and cities where they are living. So when they are going in the morning or in the evening home, in the community, in the surrounding where they are, really they are very vulnerable.
Kamagala Kenya tidabata DSW wajjiniin taane yeroo adda addaatti leenjiiwwan adda addaa.
As our city, DSW has provided us with various trainings, and extensive work has been done on youth, women and girls, including various trainings as a city and at various levels in collaboration with factories, especially related to women's health issues. We've gained a good understanding from the training to prevent them from exposing themselves to communicable diseases, HIV and unwanted pregnancies. Especially since many of the girls in the factory came from rural areas, they were exposed to unwanted pregnancies and had nothing to raise them. To eliminate this, we came up with a training given to us by DSW and provided various trainings in the factories. Therefore, we have got understanding from DSW and have been creating awareness for our youth.
DSW wajjin hani hojjechaa turre baay'ee gaariidha.
fakkeenyaaf amma akka buufata fayyaa keessatti.
So DSW, the work we have been doing is very good. For example, if a person comes to the health center as a victim of gender violence, they will get treatment at the health center. We call the police office to get legal authority. We also provide health education in factories and schools to young people on prevention before problems occur and where to go after problems happen.
Dhaabbanni kun walgahii waamanii turanii magaalaa Bishooftuutti erga leenjii laatanii as seektaroota garaagaraa waliin ta'uudhaan.
DSW had given us training in Bishoftu town. After the training, we worked with various sectors to develop plans on the problems faced by children, women and youth. Among the work done, we provided legal awareness on legal issues, what crimes against women are, what crimes against children are, how a child should be saved from this problem, where to go if a child is in trouble, how to complain without fear. We made plans and did these things. There has been a lot of change since this organization gave us training. One stop center is also set up in the health office. So DSW is doing a great job. The training given to us has enabled us to work together in a coordinated manner.
DSW erga leenjii nu kennee fi hojmaata hojjechaa kan jirru waa'ee koorniyaa irratti kan hojjennu leenjiis fudhanneerra waan ta'eef koreedhaan erga bahuu calqabnee waan gaariitu jira.
We've been working on gender since DSW gave us training, and we have started reaching out together in a coordinated manner. We have planned a coordination committee for the factories and the schools. It means that instead of going from office to office individually, we are going in coordination and teaching about gender-based violence and gender-related issues in factories and schools. Rape was common in our town. We are working on it. We are providing education, and it has improved since we came out in coordination. There are those who are to be sentenced, and there are cases that have been passed to the district court and the high court. This crime, which has previously widespread, has minimized since we started working in coordination with existing sectors, and prosecutions are decreasing.
DSW has also provided the support of different medical facilities and media instruments such as TV, speaker, LCD, flash and other materials.
Buufata kanaan kan deeggare wantoota baay'eetu jira. Fakkeenyaaf TV nu deeggareera. TV as jiru kana.
DSW gave us a lot of support for this health post. For example, the TV that we use flash so that young people will get various educations through the TV window until their term. They will sit here and read various leaflets. This way they get different health education. In addition, DSW gave us Montarbo speaker and LCD projector. They got support in many ways: pads or sanitary napkins for women and girls, and things we need in this clinic: examination bed, TV, mini media to teach and so on. It helped us a lot.
Duraan modessi namni jiru ture.
There used to be no pads or sanitary napkins. Now there are family planning methods such as pills or 3-month contraceptive injection. These were contributed by DSW. In the past, there had been girls who missed work and even went out when they got menstruation. Thanks to DSW, we can come to sister and take pads when we have menstruation.
DSW has give different materials like medical equipments like BP apparatus and many others, testing equipments, so that they see the gap, they take a list, and they asked us to provide them the list, and then they even purchase a lot of materials and gave us, and we are still using that material for teaching purpose, for medical treatment purpose, and for other purposes. So we really admire DSW on this.
Leenjii birattis immoo meeshaalee adda addaa kanneen akka televizyinii, muntaarboo, yeroo speakerii.
In addition, they have donated various equipment such as television, Montarbo speakers when awareness is given during various forums.
DSW እዚህ ላሉት ሰልጣኞች
DSW donated 2 horn amplifiers for the trainers. Here we have taken training from DSW. It also gave us TV and sanitary materials, including pads for women and girls here. Some of these things strengthened our relationship with DSW, and it was a good thing for DSW, for the generation, for this factory, and for the country.
DSW has been a great benefit to young people in general and girls in particular in creating demand for and access to user-friendly health information and services, in providing support for them both individually and at workplace.
እዚህ አካባቢ ላይ ያሉት ሴቶች ናቸው አብዛኛው እዚህ ፋብሪካችን ውስጥ ያሉት እና አብዛኛዎቹ ከገጠር አካባቢ የመጡም ስለሆኑ
Firstly, the majority of the workers here are women. Many of them are also from rural areas, so they are given education to gain a better understanding of health, and if they need access to adolescent health services, we have a referral pad with us so they can go to the health center and get services. They go and are served with that. We provide training for women, including gender equality as well as family planning.
Ana qofa miti guddanyota ko baay'ee araada garagaraa keessa jiranirre akka isaan baratanii to akka kootti jechuudha HIV maalummaa HIV titti ilaalcha HIV tiif qaban gadaana akka hin goonetti baratanii barumsa isaanii karaa sirriidhaan.
Since taking the training, I have learned how difficult is HIV that I had previously underestimated or ignored. In addition, I have taught many of my friends who were in various addictions so that they can learn and understand, like me, about the harmfulness of HIV/AIDS. I have also taught them about sexual transmitted diseases. Furthermore, I taught the training I received from DSW to my sisters, the girls around me.
Tajaajilan DSW irraa argadhe baay'eedha. Fakkeenyaaf duraanii sodaa baay'eenis na keessa ture.
There are so many services I have received from DSW. I used to have a lot of fear, but since I have trained, I have got confidence. I don't care if men laugh behind me because I have gained confidence.
በእርግጥ DSW ላይ ትልቁን እንትን ወንዶች ላይ ብቻ ወጣቶች ብለን ባንለው በይበልጥ ደግሞ ሴቶች ላይ በደንብ አስተዋጽኦ አድርጓል ብዬ አስባለሁ። አንደኛ
The biggest benefit of DSW for us is that it has been a great benefit to young people in general and girls in particular. For example, I am the first user. It gives confidence, self-determination, how to solve problems of yourself, how a girl can solve a problem happened in relationship, and how to be productive on job. I believe it has made a great contribution to making it possible for women to benefit equally with men.
DSW waan baay'eedha kan nufi as keessatti hojii guddaa hojjeteera akka kootaanillee fayyadamaa ta'e.
DSW has done a great job here. I myself have been a beneficiary and a lot of youth here too.
Erga DSW dhufee warshaalee gurguddaa kan dubartoonni itti baay'atan kana dargaggeessi itti baay'atu kana erga nuuf qabatee booda
Since DSW came and took over these factories where there are many women and young people, there is a big change because now it is offered in their workplace. Previously, they were afraid to receive and use it, but now they have gained confidence after receiving the training.
Most of the young people working in any factory, especially those from this area, come from rural areas. According to our survey of some young people, when they come to this city, they come to learn. When they come to study, they don't get an education as they expect, and girls are cheated by men. Then they go to work in factories without knowing what to do. Workers in this factory and elsewhere have been cheated by men and didn't get the lesson as they expected. But after receiving this training, they have received better direction on why they work and why they study. Hence, we believe that their previous circumstances have changed as they are working the right path to follow the right direction of life. DSW.
All the beneficiaries and DSW family, including DSW Ethiopia country director, thanked and expressed their wish for DSW development organization.
Irra caalaa dhaabbanni DSW bu'aa guddaa buuseera jedhee kanan yaadu dargaggoon ilaalcha isaanii akka jijjiiramu.
Most of all, I think DSW has been very useful in changing the attitudes of young people, and in addition to the training we have received to ensure their health.
I'd like to thank DSW organization.
Hubannoo nuu kenne nu cimse baay'ee galatoomaa ulfaadhaa jiraadhaan jedha.
DSW gave us insight. It strengthened us, and I say thank you very much. Thank you. Long live.
Galatoomaan jedha ittaansee akka jajjabaatu.
I thank DSW and wish it continued its encouragement and strengthen in the future.
On the behalf of myself, DSW and the beneficiaries, I would like to thank the David and the Lucille Packard Foundation for their generous support on the implementation of this project, particularly addressing these vulnerable young people working in flower farms and private enterprises.